Chapter 15, the Circulatory System. In this chapter, we will explore the essential components of the cardiovascular system and how they work together to sustain life. We will begin by examining the blood vessels, the intricate network responsible for transporting oxygen, nutrients, and waste throughout the body. Next, we will discuss blood pressure, how it is regulated, and why maintaining a healthy blood pressure level is vital for cardiovascular function. We will then explore resistance in the arterioles, understanding how these small blood vessels control blood flow through vasodilation and vasoconstriction. The distribution of blood to the tissues will be covered next, highlighting how different organs receive blood based on their metabolic demands. We will then analyze the regulation of cardiovascular function, focusing on the role of the cardiovascular control center and the baroreceptor reflex in maintaining homeostasis. Following that, we will take a closer look at exchange at the capillaries, where essential substances move between the bloodstream and surrounding tissues. We will also cover the lymphatic system, which plays a critical role in fluid balance, immune defense, and the removal of excess interstitial fluid. Finally, we will discuss cardiovascular disease, examining risk factors, the development of atherosclerosis, and the impact of lifestyle choices on heart health. By the end of this chapter, you will have a deeper understanding of how the cardiovascular system functions, how it adapts to changing conditions, and what steps can be taken to maintain heart health and prevent disease. The heart and blood vessels work together as a single, closed-loop system, continuously circulating blood throughout the body. Each side of the heart functions as an independent pump. The right side of the heart receives oxygen poor blood from the body through the venae cavae and pumps it to the lungs through the pulmonary arteries. In the lungs, oxygen is absorbed and carbon dioxide is released. The oxygen-rich blood then returns to the left side of the heart through the pulmonary veins and is pumped out to the rest of the body through the aorta. The elastic systemic arteries act as a pressure reservoir, maintaining blood flow even when the ventricles relax. As blood moves through smaller arterioles, these vessels adjust their diameter, regulating resistance and directing blood flow where it's needed most. At the capillaries, the real exchange happens. Oxygen and nutrients pass from the blood into the cells, while waste products like carbon dioxide move into the blood to be carried away. The blood then flows into venules and larger veins, which act as an expandable volume reservoir, helping return blood to the heart and completing the cycle. This continuous circulation is essential for life, ensuring that every cell receives the oxygen and nutrients it needs while removing waste. The cardiovascular system is truly a remarkable and efficient network. The blood vessels in our body play a crucial role in circulation, carrying blood to and from the heart. Their walls are composed of smooth muscle, along with elastic and fibrous connective tissue, allowing them to maintain structure while adapting to changes in pressure. Not all blood vessels are the same. Wall thickness varies depending on their function. Arteries, which carry blood away from the heart, have thicker walls to withstand high pressure, while veins have thinner walls with valves to help blood return to the heart. The inner layer of blood vessels, called the endothelium, is more than just a lining. It secretes paracrine factors that influence vascular function and helps regulate blood pressure, blood vessel growth, and nutrient absorption. Blood vessels also contain vascular smooth muscle, arranged in circular or spiral layers. This muscle is responsible for vasoconstriction, where vessels narrow to increase blood pressure, and vasodilation, where they widen to improve blood flow. Even at rest, blood vessels maintain a state of partial contraction, known as muscle tone, which helps regulate circulation. Together, these structures allow the cardiovascular system to efficiently deliver oxygen and nutrients while maintaining proper blood flow throughout the body. The structure of blood vessels varies depending on their function. This figure highlights the differences in diameter, wall thickness, and tissue composition across different types of blood vessels. Arteries, the largest vessels carrying blood away from the heart, have thick walls composed of multiple layers, including a substantial amount of smooth muscle and elastic tissue. This allows them to withstand high pressure and regulate blood flow. Arterioles, which are smaller branches of arteries, have a thinner wall but still contain smooth muscle. These vessels play a crucial role in controlling blood pressure by adjusting their diameter. Capillaries are the smallest blood vessels, with walls only 1 cell thick. This minimal structure allows for efficient exchange of oxygen, nutrients, and waste between the blood and surrounding tissues. Venules, which receive blood from capillaries, have slightly thicker walls but contain less smooth muscle than arterioles. They help in returning blood to the heart while allowing some exchange of molecules. Veins, the largest vessels returning blood to the heart, have thinner walls than arteries but contain more fibrous tissue. They also have valves that prevent backflow, ensuring efficient circulation despite lower pressure. Together, these different vessels form a dynamic and efficient circulatory system, ensuring that blood reaches every part of the body while adapting to changing physiological needs. Arteries and arterioles play a vital role in the circulatory system by carrying blood away from the heart to various tissues. Arteries serve as pressure reservoirs, helping to maintain blood flow even when the heart is not actively contracting. Their thick walls contain multiple layers of vascular smooth muscle, along with a substantial amount of elastic and fibrous connective tissue. This structure allows arteries to expand and contract, accommodating changes in blood pressure and ensuring continuous circulation. As blood moves further from the heart, it reaches the arterioles, smaller vessels responsible for regulating blood flow and resistance. Arterioles are less elastic and more muscular than arteries, making them crucial in controlling blood pressure and directing circulation to specific organs. They are a key component of microcirculation, adjusting their diameter to respond to the body's changing needs. Branching from the arterioles are metarterioles, which serve as transitional vessels connecting arterioles to capillaries. These vessels have a partial layer of smooth muscle and contain precapillary sphincters, tiny muscular valves that open and close to control blood flow. Depending on the body's demands, blood can either enter the capillaries for exchange or bypass them and flow directly into the venous circulation. Together, arteries, arterioles, and metarterioles ensure that oxygen-rich blood reaches every part of the body efficiently, adapting to changes in demand and maintaining stable circulation. Capillaries are the smallest blood vessels in the body and the primary site of exchange between blood and interstitial fluid. These microscopic vessels play a crucial role in delivering oxygen and nutrients to tissues while removing waste products. Capillary walls are uniquely designed for efficient exchange. Unlike arteries and veins, capillaries lack smooth muscle, making their walls extremely thin. They consist of a single flat layer of endothelial cells supported by a basal lamina, allowing for rapid diffusion of gases, nutrients, and waste between the blood and surrounding tissues. Surrounding some capillaries are specialized cells called pericytes. These contractile cells provide structural support and contribute to the regulation of capillary permeability. By secreting paracrine factors, pericytes also promote vascular growth and differentiation, helping to maintain and repair the blood vessel network. Through this intricate system, capillaries ensure that every cell in the body receives the essential substances it needs while effectively removing metabolic waste. This makes them a vital component of the circulatory system, supporting overall health and function. Capillary beds are networks of tiny blood vessels that facilitate the exchange of gases, nutrients, and waste between blood and tissues. These beds are a crucial part of microcirculation, adjusting blood flow based on the body's needs. At the entrance of capillary networks, precapillary sphincters act as muscular gates that regulate blood flow. When these sphincters are relaxed, as shown in part B, blood flows freely through the entire capillary bed, maximizing exchange with surrounding tissues. However, in certain conditions, precapillary sphincters constrict, as illustrated in part C. This redirects blood away from capillaries and through metarterioles, which serve as bypass channels. This mechanism allows the body to prioritize blood flow to essential areas, such as muscles during exercise or vital organs in times of stress. Metarterioles and arteriovenous bypasses provide alternative pathways for circulation, ensuring that blood continues to move efficiently even when capillary flow is restricted. These adjustments in blood flow help maintain homeostasis and meet the body's ever-changing metabolic demands. Through this dynamic system, capillary beds serve as vital hubs of exchange, ensuring that tissues receive the oxygen and nutrients they need while efficiently removing metabolic waste. As blood completes its journey through the capillaries, it flows into the venules, the smallest veins in the circulatory system. Venules play a critical role in collecting deoxygenated blood from capillary beds and directing it toward larger veins. Their thin exchange epithelium and minimal connective tissue allow for continued nutrient and waste exchange before blood moves onward. The flow pattern in venules is convergent, meaning multiple small vessels merge to form larger veins. Once in the veins, blood is transported back to the heart. Unlike arteries, veins have thin walls of vascular smooth muscle and contain significantly less elastic tissue. They function as a volume reservoir, holding a large portion of the body's blood supply. To ensure efficient circulation, veins contain one-way valves that prevent blood from flowing backward, especially in the lower body where gravity can pose a challenge. Veins are also more numerous than arteries and tend to lie closer to the body's surface, making them visible beneath the skin. Together, venules and veins form a low-pressure system that steadily returns blood to the heart, ensuring that circulation remains continuous and balanced throughout the body. Unlike arteries, veins operate under low pressure and rely on specialized structures to ensure blood flows in the right direction. This figure illustrates how valves in the veins and skeletal muscle contractions work together to return blood to the heart. On the left, we see a closed valve. These one-way valves prevent the backflow of blood, ensuring that it moves steadily toward the heart, even against the force of gravity. On the right, the skeletal muscle surrounding the vein contracts, compressing the vein and forcing blood upward. This mechanism, known as the skeletal muscle pump, pushes blood toward the heart while the valves open and close in sequence to prevent it from flowing backward. This process is especially important in the legs, where blood must travel against gravity. Regular movement, such as walking or flexing the leg muscles, enhances circulation and prevents issues like blood pooling or clot formation. Through the coordinated action of valves and skeletal muscles, veins efficiently transport deoxygenated blood back to the heart, completing the circulatory loop. Blood pressure is the force exerted by circulating blood against the walls of blood vessels. It is highest in the arteries and lowest in the veins, ensuring that blood moves efficiently through the circulatory system. One key measurement of blood pressure is pulse pressure, which represents the strength of the pressure wave created by ventricular contraction. Pulse pressure is calculated as the difference between systolic pressure and diastolic pressure and gradually decreases as blood moves through the circulatory system due to friction. Venous return, or the movement of blood back to the heart, is aided by valves, the skeletal muscle pump, and the respiratory pump to maintain circulation. To better understand blood pressure regulation, we use mean arterial pressure, or MAP, which reflects the driving force behind blood flow. MAP is calculated using the equation MAP equal diastolic pressure plus 1/3 of the pulse pressure. When MAP falls below the normal range, it results in hypotension, or low blood pressure, which can lead to inadequate blood flow to organs. Conversely, hypertension, or high blood pressure, occurs when MAP is elevated, increasing the risk of cardiovascular disease. Blood pressure is commonly measured using a sphygmomanometer, a device that detects cough sounds, the sounds produced as blood begins to flow through a partially compressed artery. These measurements help assess cardiovascular health and detect potential circulatory issues. By monitoring and regulating blood pressure, the body ensures a steady and controlled flow of oxygen-rich blood to all tissues, maintaining overall health and function. Blood flow through the cardiovascular system is determined by three key factors: pressure, flow, and resistance. The fundamental principle governing circulation states that blood flow is directly proportional to the difference in pressure and inversely proportional to resistance. For blood to move, a pressure difference must exist within the system. This means that blood will always flow from an area of higher pressure to an area of lower pressure. However, this movement is not without opposition. Resistance, which acts against blood flow, is a key factor that regulates circulation. There are three major factors that influence resistance in blood vessels. The first is the radius of the vessel. Smaller blood vessels create more resistance, making it harder for blood to pass through. The second is the length of the blood vessel. Longer vessels increase resistance and require more force to move blood efficiently. The third factor is the viscosity of the blood. Thicker blood flows more slowly and requires more effort to circulate. Blood flow is measured in liters or milliliters per minute, reflecting the volume of blood moving through the system. The speed at which blood moves, known as velocity, is expressed in centimeters or millimeters per second. When the rate of blood flow remains constant, the primary factor that determines the speed of movement is the total cross-sectional area of the blood vessels. For example, capillaries have a large total cross-sectional area, which causes blood to move more slowly, allowing for optimal exchange of oxygen, nutrients, and waste. By understanding the relationships between pressure, flow, and resistance, we can see how the body regulates circulation to maintain homeostasis and meet the needs of different organs and tissues. Arteries play a critical role in maintaining continuous blood flow by acting as a pressure reservoir. This figure illustrates how arteries store and release pressure through the cardiac cycle. During ventricular contraction, the ventricles push blood into the elastic arteries. As the left ventricle contracts, the semilunar valve opens, allowing blood to be ejected from the heart into the aorta and other major arteries. These arteries expand, stretching their elastic walls to store the pressure generated by the heart's contraction. As the heart enters the relaxation phase, known as ventricular diastole, the semilunar valve closes to prevent blood from flowing backward into the ventricle. At the same time, the elastic fibers in the artery walls recoil, pushing the stored blood forward into the circulatory system. This elastic recoil helps maintain a steady flow of blood, even when the heart is not actively pumping. By acting as a pressure reservoir, arteries ensure that blood moves efficiently through the body, providing continuous circulation to vital organs and tissues. This mechanism allows for smooth and consistent blood flow, reducing fluctuations in pressure between heartbeats. Blood pressure is commonly measured using a device called a sphygmomanometer, which consists of an inflatable cuff and a pressure gauge. This measurement is performed using a stethoscope placed over the brachial artery to listen for changes in blood flow. The process begins by inflating the cuff to a pressure greater than the individual's systolic blood pressure, which in this case is 120 millimeters of mercury. At this stage, the pressure in the cuff is high enough to completely stop blood flow through the artery, and no sound can be heard through the stethoscope. As the cuff is gradually deflated, the pressure falls to a level between the systolic and diastolic pressures, typically between 80 and 120 millimeters of mercury. At this point, the artery begins to open slightly with each heartbeat, allowing pulsatile blood flow. This turbulent flow creates distinct tapping sounds known as coracough sounds, which can be heard through the stethoscope. The first occurrence of these sounds marks the systolic blood pressure. When the cuff pressure drops below the individual's diastolic blood pressure, in this case, 80 millimeters of mercury, the artery is no longer compressed. Blood flows smoothly, and the coracough sounds disappear. The pressure at which the last sound is heard represents the diastolic blood pressure. This method of measuring blood pressure provides essential information about cardiovascular health, allowing for the diagnosis and monitoring of conditions such as hypertension and hypotension. Mean arterial pressure, which represents the average pressure in the arteries, is determined by two primary factors: cardiac output and peripheral resistance. The relationship between these factors can be expressed as mean arterial pressure being directly proportional to cardiac output multiplied by the resistance of the arterioles. Cardiac output refers to the amount of blood ejected from the left ventricle into the aorta per minute. This flow of blood into the arterial system plays a crucial role in maintaining adequate circulation throughout the body. Changes in blood volume also have a direct impact on blood pressure. Under normal conditions, blood volume remains relatively stable, with minor fluctuations occurring throughout the day. If blood volume increases, blood pressure also rises. The kidneys help regulate this balance by removing excess fluid through urine production. Conversely, when blood volume decreases, blood pressure drops. The body compensates for this loss by triggering mechanisms such as increased fluid intake through drinking or intravenous infusion. Additionally, the blood vessels constrict, a process known as vasoconstriction, while the heart receives sympathetic stimulation to increase cardiac output and restore blood pressure levels. By maintaining a balance between cardiac output, blood volume, and vascular resistance, the body ensures proper circulation and stable blood pressure, which are essential for overall cardiovascular health. Mean arterial pressure is determined by two key factors: cardiac output and resistance in the arterioles, also known as peripheral resistance. This relationship ensures that blood flow is regulated to meet the body's demands. Mean arterial pressure represents the balance between the amount of blood entering the arteries, which is controlled by cardiac output, and the amount of blood leaving the arteries, which is influenced by changes in peripheral resistance. As arterial volume increases, pressure within the arteries also rises. In this model, the left ventricle is represented by a syringe, illustrating how the heart pumps blood into the elastic arteries. These arteries act as pressure reservoirs, storing energy during systole and releasing it during diastole to maintain continuous blood flow. The arterioles, which are the primary site of resistance, regulate blood flow through adjustable narrowing or widening of their diameter. This is represented in the diagram by variable screws that simulate changes in resistance. When arterioles constrict, resistance increases, leading to higher arterial pressure. When arterioles dilate, resistance decreases, allowing blood to flow more easily and lowering arterial pressure. This relationship between cardiac output and peripheral resistance plays a crucial role in maintaining stable circulation, ensuring that blood reaches vital organs efficiently. By adjusting these factors, the body can regulate blood pressure to adapt to various physiological conditions. Mean arterial pressure is influenced by several key factors that regulate blood flow and circulation throughout the body. This diagram breaks down the primary determinants of mean arterial pressure into four categories: blood volume, the effectiveness of the heart as a pump, resistance to blood flow, and the distribution of blood between arterial and venous vessels. Blood volume is a major contributor to arterial pressure. It is determined by the balance between fluid intake and fluid loss. If blood volume increases, blood pressure rises. If volume decreases, blood pressure falls. This process may occur passively or be actively regulated by the kidneys, which help remove excess fluid when needed. The effectiveness of the heart as a pump, also known as cardiac output, plays a crucial role in maintaining pressure. This is determined by two factors: heart rate, which is the number of beats per minute, and stroke volume, which is the amount of blood ejected from the heart with each contraction. A stronger or faster heartbeat increases cardiac output, leading to higher arterial pressure. Resistance within the circulatory system also impacts blood pressure. The primary factor controlling this resistance is the diameter of the arterioles. When arterioles constrict, resistance increases, causing blood pressure to rise. When they dilate, resistance decreases, allowing blood to flow more freely and lowering blood pressure. Finally, the relative distribution of blood between arterial and venous blood vessels plays a role in determining mean arterial pressure. This is influenced by the diameter of the veins. Veins act as a volume reservoir, holding a large portion of the body's blood. When veins constrict, more blood is pushed into circulation, increasing arterial pressure. When veins dilate, they store more blood, reducing pressure in the arteries. Together, these factors work dynamically to regulate blood pressure and ensure stable circulation, adapting to the body's changing needs. When blood volume increases, it leads to a rise in blood pressure. The body has two primary mechanisms to compensate for this increase: a fast response by the cardiovascular system and a slower response by the kidneys. The fast response is initiated by the cardiovascular system and is controlled by baroreceptors, which are specialized pressure-sensitive cells located in the walls of major arteries. These receptors send signals to the brainstem, triggering a response to lower blood pressure. The cardiovascular system responds by dilating the blood vessels, a process known as vasodilation, which increases the diameter of the arteries and reduces resistance to blood flow. Additionally, the heart decreases its output by reducing the force and rate of contractions. These combined actions help lower blood pressure back to normal. The slow response involves the kidneys, which regulate blood volume over a longer period. When blood volume is too high, the kidneys increase the excretion of fluid through urine. By removing excess fluid from the bloodstream, overall blood volume decreases, which in turn lowers blood pressure. Together, these two mechanisms ensure that blood pressure remains within a healthy range, protecting the body from the harmful effects of hypertension and maintaining stable circulation. Arterioles are the primary regulators of blood flow and resistance within the circulatory system. Their resistance is influenced by both local and systemic control mechanisms that adjust vessel diameter to meet the body's needs. Local control of arterioles is regulated through signals that originate within the tissues. This includes the body's automatic responses, known as sympathetic reflexes, and hormonal influences that help maintain blood pressure and distribute blood to essential organs. One key mechanism of regulation is myogenic autoregulation, where vascular smooth muscle adjusts its own level of contraction in response to changes in blood pressure. When the smooth muscle in arterioles is stretched due to an increase in pressure, mechanically gated calcium channels open, causing the muscle to contract. This contraction acts as a protective mechanism to resist excessive stretching and maintain stable blood flow. In addition to these mechanical responses, paracrine signals, which are chemical signals released by nearby cells, also influence vascular smooth muscle tone. These signals include substances secreted by the vascular epithelium or surrounding cells. One example of this regulation is hyperemia, which describes an increase in blood flow. Active hyperemia occurs when tissues demand more oxygen, such as during exercise, while reactive hyperemia is a response to temporary blood flow restriction. Another important signaling molecule is nitric oxide, a potent vasodilator that relaxes blood vessels and increases circulation. Other chemical mediators, such as kinins and histamine, also promote vasodilation and enhance blood flow to tissues. Through the combined effects of mechanical regulation, nervous system control, and chemical signaling, the arterioles play a crucial role in maintaining blood pressure and distributing blood where it is needed most. The regulation of cardiovascular function is controlled by the Cardiovascular Control Center, which coordinates responses to maintain stable blood pressure and circulation. One of the primary mechanisms involved in blood pressure regulation is the baroreceptor reflex. Baroreceptors are specialized mechanoreceptors located in the carotid arteries and the aorta. These receptors continuously monitor blood pressure by producing a steady stream of action potentials that are sent to the brainstem. When blood pressure changes, the frequency of these signals also changes, allowing the cardiovascular system to adjust accordingly. This reflex is always active, ensuring that blood pressure remains within a normal range. One situation where the baroreceptor reflex plays a critical role is in orthostatic hypotension, a temporary drop in blood pressure that occurs when a person changes position too quickly, such as moving from lying down to standing up. In this case, blood may pool in the lower body due to gravity, reducing the amount of blood returning to the heart and leading to a temporary decrease in blood pressure. If the body fails to compensate quickly enough, it can result in a reduced supply of oxygen to the brain, leading to symptoms such as lightheadedness or dizziness. The baroreceptor reflex helps counteract this by triggering a rapid increase in heart rate and vasoconstriction, restoring normal blood flow to the brain. Through the continuous function of the cardiovascular control center and the baroreceptor reflex, the body maintains stable blood pressure and ensures an adequate supply of oxygen and nutrients to all tissues. The cardiovascular system is regulated by the central nervous system, which controls the heart and blood vessels to maintain stable circulation. The medullary cardiovascular control center, located in the brainstem, plays a key role in this process by integrating sensory input and adjusting cardiovascular function accordingly. Changes in blood pressure are detected by specialized receptors known as carotid and aortic baroreceptors, which continuously monitor pressure levels in the major arteries. When blood pressure increases or decreases, these receptors send signals to the brain through sensory neurons, providing real-time feedback on the body's circulatory status. In response, the cardiovascular control center adjusts heart rate and blood vessel diameter through two distinct pathways: the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system increases heart rate and enhances the force of contraction by stimulating the sinoatrial node and ventricles. It also causes vasoconstriction in the arterioles and veins, increasing blood pressure when needed. In contrast, the parasympathetic nervous system slows the heart rate by acting on the sinoatrial node, helping to reduce blood pressure when necessary. By continuously balancing these signals, the medullary cardiovascular control center ensures that blood pressure and circulation remain stable, adapting to the body's changing needs in real time. The baroreceptor reflex is a critical mechanism that helps maintain stable blood pressure. This diagram illustrates how the body responds to an increase in mean arterial pressure through a negative feedback loop. When blood pressure rises, baroreceptors located in the carotid arteries and aorta detect the change and increase their firing rate. These sensory neurons send signals to the cardiovascular control center in the medulla oblongata, which processes the information and initiates a response. To lower blood pressure, the medulla decreases sympathetic output, reducing the release of norepinephrine. This has several effects. The arteriolar smooth muscle relaxes, leading to vasodilation, which decreases peripheral resistance. The ventricular myocardium reduces the force of contraction, and the sinoatrial node slows the heart rate, both of which contribute to a decrease in cardiac output. At the same time, parasympathetic output increases, releasing more acetylcholine onto muscarinic receptors, further slowing the heart rate. These combined actions work together to lower blood pressure back to normal. This process is an example of negative feedback, where the body continuously monitors and adjusts cardiovascular function to maintain stability. Through this finely tuned system, the baroreceptor reflex ensures that blood pressure remains within a safe range, preventing excessive fluctuations that could impact circulation and organ function. Capillaries are the primary sites of exchange between the blood and surrounding tissues. Plasma and cells exchange nutrients, gases, and waste products across the thin capillary walls, ensuring that every cell receives the substances it needs for survival. Most cells in the body are located within 1/10 of a millimeter from the nearest capillary, allowing for efficient diffusion. The density of capillaries in a particular tissue is closely related to its metabolic activity. Tissues with high energy demands, such as muscles and the brain, have a greater number of capillaries to support their needs. Capillaries have the thinnest walls of any blood vessel, consisting of a single layer of flattened endothelial cells, supported by a basal lamina. This thin structure facilitates the rapid exchange of gases, nutrients, and waste products. There are different types of capillaries, each specialized for its function. Continuous capillaries have tightly connected endothelial cells, allowing only small molecules to pass through, making them common in the brain and muscles. Fenestrated capillaries have small pores, or fenestrations, that enhance permeability, making them ideal for tissues involved in filtration, such as the kidneys and intestines. Another specialized type is the sinusoid, a modified capillary vessel found in the bone marrow, liver, and spleen. Sinusoids have larger openings that allow the exchange of larger molecules, including blood cells, making them essential for immune function and blood cell production. Through these specialized structures, capillaries efficiently regulate the exchange of substances, ensuring that tissues receive the oxygen and nutrients they need while removing metabolic waste. Capillaries are the smallest blood vessels in the body and serve as the primary site for the exchange of gases, nutrients, and waste between the blood and surrounding tissues. This diagram highlights two major types of capillaries: continuous capillaries and fenestrated capillaries. Continuous capillaries, shown on the left, have tightly connected endothelial cells, but contain small junctions that allow water and small dissolved solutes to pass through. These capillaries are found in muscle, connective tissue, and the brain, where they form the blood-brain barrier to regulate the movement of substances. Additionally, some substances, such as proteins and large molecules, are transported across the endothelial layer by transcytosis, a process in which vesicles carry molecules through the cell. Some vesicles may even fuse to create temporary channels for transport. On the right, fenestrated capillaries have large pores, or fenestrations, that enhance permeability. These capillaries allow for rapid exchange of larger molecules and fluids, making them particularly common in tissues that require extensive filtration, such as the kidneys, intestines, and endocrine glands. The presence of pores facilitates the movement of macromolecules while still being supported by a basement membrane. Both continuous and fenestrated capillaries play crucial roles in maintaining proper circulation and tissue function. Their structural differences allow the body to regulate nutrient exchange efficiently based on the specific needs of different organs. Capillary exchange is the process by which nutrients, gases, and waste products move between the blood and interstitial fluid. This exchange occurs through two primary pathways. The pericellular pathway, where substances pass between endothelial cells, and endothelial transport, where molecules cross directly through the capillary walls. One of the main mechanisms of exchange is diffusion, which allows small dissolved solutes and gases to move across the capillary walls. The movement of these molecules depends on their lipid solubility and concentration gradient. For example, oxygen and carbon dioxide diffuse freely across the capillary membrane, following their respective concentration gradients to reach areas where they are needed. For larger solutes and proteins, vesicular transport plays a crucial role. These molecules cannot pass freely through the capillary walls, so they are transported using transcytosis. In this process, vesicles carry large molecules across the endothelial cells, releasing them on the other side. This method is particularly important for moving select proteins and macromolecules that are essential for cellular function. By utilizing diffusion for small molecules and transcytosis for larger ones, capillaries efficiently regulate the exchange of substances, ensuring that tissues receive the oxygen and nutrients they need while removing metabolic waste. Bulk flow is the mass movement of fluid across capillary walls, driven by hydrostatic and osmotic pressure gradients. This process plays a key role in maintaining fluid balance between the blood and surrounding tissues. Filtration refers to the movement of fluid out of the capillaries into the interstitial space. This is primarily caused by hydrostatic pressure, which is the force exerted by blood against the capillary walls. If the hydrostatic pressure in the surrounding interstitial fluid is negligible, then the pressure difference favors fluid movement outward. However, hydrostatic pressure gradually decreases along the length of the capillary due to friction as blood moves through. Absorption is the process of fluid moving back into the capillaries. This is driven by colloid osmotic pressure, also known as oncotic pressure, which is generated by plasma proteins that remain in the blood. These proteins create a pressure gradient that pulls water back into the capillaries. While capillaries contain proteins that exert osmotic pressure, the surrounding interstitial fluid has little to no protein, leading to a net inward movement of fluid. The net pressure at any given point in the capillary determines the direction of bulk flow. This is calculated as hydrostatic pressure minus colloid osmotic pressure. At the arterial end of the capillary, hydrostatic pressure is greater than osmotic pressure, resulting in net filtration. At the venous end, hydrostatic pressure drops below osmotic pressure, leading to net absorption of fluid back into the bloodstream. This balance between filtration and absorption is essential for maintaining proper fluid distribution. ensuring that tissues receive the necessary nutrients while preventing excess fluid buildup in the interstitial space. Capillary fluid exchange is essential for maintaining fluid balance between the blood and surrounding tissues. This process ensures the delivery of nutrients and the removal of waste while regulating overall circulation. As blood moves from the arteriole into the capillary bed, net filtration occurs at the arterial end of the capillary. Here, hydrostatic pressure pushes fluid out of the capillary into the interstitial space. This allows oxygen and nutrients to diffuse into surrounding tissues. At the venous end of the capillary, hydrostatic pressure decreases, and net absorption takes place. Osmotic pressure, driven by plasma proteins, pulls fluid back into the capillary, helping to maintain blood volume and return waste products to the circulation. However, not all of the filtered fluid is reabsorbed. On average, 3 liters of fluid per day remains in the interstitial space. This excess fluid is picked up by the lymphatic vessels, which return it to the venous circulation. The lymphatic system plays a crucial role in preventing fluid buildup in tissues and maintaining proper blood volume. By balancing filtration, absorption, and lymphatic drainage, the body ensures a stable fluid environment, allowing for proper circulation and tissue function. Capillary fluid exchange is driven by the balance between hydrostatic pressure and colloid osmotic pressure within systemic capillaries. These forces determine whether fluid moves out of the capillary into the surrounding tissues or is reabsorbed back into the bloodstream. Hydrostatic pressure is the force exerted by blood against the capillary walls, pushing fluid outward. Colloid osmotic pressure, represented by pi, is generated by plasma proteins inside the capillary and pulls fluid back into the bloodstream. At the arterial end of the capillary, hydrostatic pressure is higher than colloid osmotic pressure, measuring 32 millimeters of mercury compared to 25 millimeters of mercury. This positive net pressure favors filtration, meaning fluid moves out of the capillary and into the interstitial space. As blood flows through the capillary, hydrostatic pressure gradually decreases due to resistance and friction. By the venous end, hydrostatic pressure drops to 15 millimeters of mercury, which is now lower than colloid osmotic pressure. This results in net absorption, where fluid is pulled back into the capillary, helping maintain blood volume. Despite this balance, there is a net loss of approximately 3 liters of fluid per day that remains in the interstitial space. This excess fluid is collected by the lymphatic system and returned to circulation to prevent swelling and maintain blood volume. By regulating the interaction between hydrostatic and osmotic forces, the capillary system ensures proper fluid exchange, delivering essential nutrients while preventing fluid buildup in tissues. The lymphatic system plays a crucial role in maintaining fluid balance, absorbing fats, and defending the body against infections. It serves as an essential component of the circulatory and immune systems. One of the primary functions of the lymphatic system is to return excess fluid and proteins from the interstitial space back into the circulatory system. This prevents fluid accumulation in tissues and helps maintain stable blood volume. Additionally, the lymphatic system picks up dietary fats absorbed in the intestines and transfers them into the circulatory system for distribution. Another key function of the lymphatic system is to filter pathogens and support immune responses. Lymph nodes, located along lymphatic vessels, act as checkpoints that trap bacteria, viruses, and other harmful substances, preventing them from spreading throughout the body. The lymphatic system is designed for one-way movement of fluid from the interstitial space back into circulation. Lymphatic capillaries, which are blind-ended, collect excess fluid and proteins. These capillaries merge into larger lymphatic vessels, which contain semilunar valves to ensure that lymph flows in one direction toward the venous circulation. Lymph nodes along these vessels filter and monitor the fluid before it is returned to the bloodstream. When the lymphatic system fails to drain excess fluid efficiently, or when capillary filtration exceeds reabsorption, edema can occur. This results in the accumulation of fluid in the interstitial space, leading to swelling in affected tissues. Through its role in fluid regulation, fat absorption, and immune defense, the lymphatic system is essential for maintaining overall health and homeostasis in the body. The lymphatic system is a vital network of vessels, nodes, and organs that support circulation and immunity. It helps maintain fluid balance, filters pathogens, and transports fats and proteins back into the bloodstream. Lymphatic vessels extend throughout the body, collecting excess fluid from tissues. This fluid, known as lymph, is filtered through a series of lymph nodes, which contain immune cells that help detect and fight infections. At the top of the system, the cervical lymph nodes are located in the neck, helping to filter lymph from the head and throat. The right lymphatic duct and the thoracic duct are the main pathways that return lymph to the venous circulation. The thoracic duct, located in the chest, collects lymph from most of the body and drains it back into the bloodstream. In the upper body, the axillary lymph nodes filter lymph from the arms and chest, including the lymphatics of the mammary gland. The spleen, located in the abdomen, is another critical lymphatic organ where blood is filtered and old or damaged red blood cells are removed. Further down, the lumbar lymph nodes filter lymph from the lower back, while the pelvic and inguinal lymph nodes regulate fluid and immune responses in the lower body and legs. The lymphatics of the lower limb ensure proper drainage of excess fluid from the legs, preventing swelling. At the tissue level, blind-ended lymph capillaries collect interstitial fluid, proteins, and waste products, directing them into larger lymphatic vessels for transport back to the bloodstream. Through this extensive network, the lymphatic system plays a crucial role in fluid homeostasis, immune defense, and waste removal, ensuring the body remains healthy and balanced. This historical photograph from the 1960s was taken in a Nigerian refugee camp and shows a child suffering from kwashiorkor, a severe form of protein malnutrition. One of the most recognizable symptoms of this condition is ascites, also known as abdominal edema, where fluid accumulates in the abdomen, causing noticeable swelling. Kwashiorkor occurs when a child's diet lacks sufficient protein, despite an adequate intake of calories. This deficiency disrupts the body's ability to maintain proper fluid balance, leading to low plasma protein levels. Without enough proteins like albumin in the bloodstream, the colloid osmotic pressure inside capillaries decreases, preventing fluid from being reabsorbed. As a result, excess fluid remains trapped in the interstitial spaces, particularly in the abdomen, causing the characteristic swelling seen in kwashiorkor. In addition to severe fluid retention, children with kwashiorkor often experience muscle wasting, weakened immune function, and skin changes. The condition is commonly seen in regions affected by food shortages, famine, or displacement, where access to adequate nutrition is limited. Early intervention with proper nutrition, protein supplementation, and medical care can reverse kwashiorkor and restore normal growth and development. This image serves as a powerful reminder of the importance of adequate nutrition and global efforts to combat malnutrition and food insecurity. Cardiovascular disease is a leading cause of death worldwide, influenced by both genetic and lifestyle factors. Understanding the risks and mechanisms behind cardiovascular disease can help with prevention and management. Several risk factors contribute to cardiovascular disease, including smoking, obesity, and high cholesterol levels. Some factors, such as sex, age, and family history, are not controllable. However, many risk factors are modifiable, meaning they can be managed through lifestyle changes. These include smoking, obesity, a sedentary lifestyle, and untreated high blood pressure. Certain genetic conditions, such as diabetes mellitus, also increase the risk of cardiovascular disease. Diabetes is a metabolic disorder that contributes to the development of atherosclerosis, a condition where plaque builds up inside the arteries, restricting blood flow. However, even in individuals with a genetic predisposition, lifestyle modifications such as a healthy diet and regular exercise can help reduce the risk of developing heart disease. Atherosclerosis is considered an inflammatory process, triggered by an imbalance of cholesterol and triglycerides in the blood. Two major types of cholesterol play different roles in heart health. High-density lipoprotein cholesterol, or HDL, is known as healthy cholesterol because it helps remove excess cholesterol from the bloodstream. In contrast, low-density lipoprotein cholesterol, or LDL, is considered lethal cholesterol because it contributes to plaque formation. A specific protein called APA binds to LDL receptors, further promoting plaque accumulation in the arteries. Atherosclerosis is a progressive disease characterized by the buildup of plaques inside the arteries. This process begins with changes in the arterial wall that gradually restrict blood flow and increase the risk of cardiovascular complications. A normal arterial wall consists of endothelial cells, elastic connective tissue, and smooth muscle cells, which help maintain the vessel's flexibility and function. However, when low-density lipoprotein cholesterol accumulates between the endothelium and connective tissue, it becomes oxidized. This marks the beginning of plaque formation. In response, the body's immune system attempts to remove the oxidized cholesterol. Macrophages, a type of immune cell, ingest the cholesterol, but instead of eliminating it, they become foam cells. These foam cells accumulate, forming the foundation of an early plaque known as a fatty streak. As the process continues, smooth muscle cells are attracted to the site by signals released from macrophages. These muscle cells begin to divide and take up cholesterol, further contributing to plaque growth. Over time, the plaque hardens, narrows the artery, and reduces blood flow, increasing the risk of heart attacks and strokes. By understanding how atherosclerotic plaques develop, we can recognize the importance of maintaining healthy cholesterol levels, adopting a heart-healthy diet, exercising regularly, and avoiding smoking to prevent and slow the progression of cardiovascular disease. Atherosclerosis progresses over time, with plaques developing inside the arteries, leading to potential cardiovascular complications. This diagram illustrates the transition from a stable fibrous plaque to a vulnerable plaque, which increases the risk of serious events such as heart attacks and strokes. In the stable fibrous plaque stage, a lipid core accumulates beneath the endothelial layer of the artery. In an attempt to contain this lipid buildup, the body forms a fibrous scar tissue layer, which acts as a protective barrier. Smooth muscle cells continue to divide, contributing to thickening of the arterial wall, a process known as intimal thickening. Over time, calcium deposits form within the plaque, further hardening the arterial walls and reducing their flexibility. However, as the plaque grows, it can become unstable. In the vulnerable plaque stage, macrophages within the plaque may release enzymes that degrade collagen, weakening the structural integrity of the plaque. This transformation makes the plaque more prone to rupture. If the plaque ruptures, platelets within the bloodstream come into contact with the exposed collagen, triggering blood clot formation. This clot, also known as a thrombus, can partially or completely block blood flow, leading to life-threatening events such as heart attacks and strokes. Understanding the progression of atherosclerosis highlights the importance of maintaining healthy cholesterol levels, managing blood pressure, avoiding smoking, and following a heart-healthy lifestyle to reduce the risk of plaque formation and prevent cardiovascular disease. Hypertension, or high blood pressure, is a serious condition that represents a failure of the body's ability to maintain cardiovascular homeostasis. It is one of the leading risk factors for cardiovascular disease, and its effects can be life-threatening if left untreated. Research shows that the risk of developing cardiovascular disease doubles with every 20/10 millimeters of mercury increase in blood pressure above the baseline value of 115/75 millimeters of mercury. This highlights the importance of maintaining healthy blood pressure levels. Hypertension is classified into primary hypertension and secondary hypertension. Primary hypertension, also called essential hypertension, accounts for 90% of cases. It has no identifiable cause other than hereditary factors. In these cases, cardiac output remains normal, but there is increased resistance in the arterioles, which forces the heart to work harder to maintain circulation. Secondary hypertension accounts for 10% of cases and is caused by an underlying medical condition such as kidney disease or hormonal disorders. Identifying and treating the root cause is essential for managing secondary hypertension. Hypertension is a major risk factor for atherosclerosis, as persistently high blood pressure damages the arterial walls, making them more susceptible to plaque formation. Over time, the heart muscle undergoes hypertrophy, meaning it thickens in response to increased workload. This can lead to complications such as pulmonary edema, where fluid accumulates in the lungs, and congestive heart failure, where the heart is no longer able to pump blood effectively. Fortunately, hypertension can be managed with lifestyle modifications and medications. Common treatments include calcium channel blockers, diuretics, beta-blocking drugs, angiotensin-converting enzyme inhibitors, and angiotensin receptor blockers. These medications work by relaxing blood vessels, reducing fluid retention, and lowering overall blood pressure. By addressing hypertension early and maintaining a healthy lifestyle, individuals can significantly reduce their risk of cardiovascular disease and improve long-term heart health. This graph illustrates the direct relationship between blood pressure levels and the risk of developing cardiovascular disease. As blood pressure increases, the risk of cardiovascular complications rises exponentially. Studies show that for every 20/10 millimeters of mercury increase in blood pressure above a baseline of 115/75 millimeters of mercury, the risk of cardiovascular disease doubles. This means that individuals with a blood pressure of 195/115 millimeters of mercury have a risk more than 20 times higher than those with normal blood pressure. The relationship between blood pressure and cardiovascular risk follows a nonlinear pattern, meaning that as blood pressure climbs to higher levels, the increase in risk becomes even more pronounced. High blood pressure places excessive strain on the heart, blood vessels, and organs, leading to conditions such as atherosclerosis, heart failure, stroke, and kidney disease. By maintaining blood pressure within a healthy range, individuals can significantly reduce their risk of cardiovascular disease. Lifestyle modifications such as regular exercise, a heart-healthy diet, stress management, and medication when necessary are essential for controlling blood pressure and preventing long-term complications. This data highlights the critical need for early intervention and monitoring to ensure long-term cardiovascular health and prevent life-threatening outcomes. In this presentation, we explored the essential components of the cardiovascular system and their role in maintaining circulation and overall health. We began with an overview of the blood vessels, understanding their structure and function in transporting oxygen, nutrients, and waste throughout the body. Next, we examined blood pressure, the force exerted by circulating blood against vessel walls, and how it is regulated to maintain homeostasis. We then explored resistance in the arterioles, learning how these small blood vessels control blood flow through vasoconstriction and vasodilation. We also discussed the distribution of blood to the tissues, emphasizing how organs receive an adequate supply of oxygen and nutrients based on their metabolic demands. The regulation of cardiovascular function was examined, highlighting the role of the cardiovascular control center and the baroreceptor reflex in maintaining stable blood pressure. We then analyzed exchange at the capillaries, where nutrients, gases, and waste products move between the bloodstream and surrounding tissues through diffusion and transcytosis. Our discussion continued with the lymphatic system, which plays a crucial role in fluid balance, immune defense, and the return of excess interstitial fluid to circulation. Finally, we covered cardiovascular disease, emphasizing risk factors such as hypertension, atherosclerosis, and lifestyle choices that contribute to heart disease and stroke. By understanding these fundamental aspects of the cardiovascular system, we gain valuable insight into how to protect heart health and prevent disease through lifestyle choices, early detection, and medical intervention. Thank you for your attention, and I encourage you to take proactive steps toward maintaining a healthy cardiovascular system.